Several infectious diseases are on the rise in this country, and all are sexually transmitted: chlamydia, gonorrhea, and syphilis. New statistics underline what is being called an alarming increase in the number of cases over the past decade. Figures show chlamydia is up 49% across Canada. Gonorrhea has jumped by 81%, and syphilis infections have soared 178%. Ottawa recently earmarked $32 million for research into sexually transmitted and blood-borne infectious. My next guest says some Canadians are more at risk than others. Those who are most vulnerable tend to be from marginalized communities where proper health care is often lacking. Joining me now is Alex McKay. Alex is the Executive Director for Sex Information and Education Council of Canada. Alex, welcome to you.
Good to be here.
So we're seeing the surge in syphilis, chlamydia, gonorrhea. What's going on?
I think we're looking at a convergence of four main factors that's leading to this rise in sexually transmitted infections. One of them, I think, is that in recent years we've seen medical advances in the treatment and prevention of HIV. And that's led to a decrease in the motivation to use condoms. And I think that's spread pretty generally throughout the population. Another thing researchers are looking at is the use of social media apps, Tinder, Grindr, as well as the prevalence of online porn and whether that's impacting people's sexual behavior. We have a study coming out soon which is looking at that. And for example, we found that men who watch a lot of online porn are significantly less likely to use condoms. One thing that hasn't changed is that there's really a strong stigma associated with sexually transmitted infections, and that particularly impacts marginalized communities, where people really may feel a stigma around accessing STI testing and STI treatment. And we really need to work on reducing that stigma. And then lastly, I think really an important point is that we really need to make sure that young people in the school system are receiving consistent, high-quality sexual health education, because that's lacking as well.
Let's break down some of those ideas. First of all, why has condom use, I guess the way to put it, you say condom use has dropped because people aren't as afraid of HIV as they used to be. Why aren't they?
Well, I think the advances in treatment and prevention around HIV and the perception, which is true, that HIV is not a death sentence anymore and that people can lead healthy lives with HIV, caused, I think, a big sigh of relief amongst a lot of people who were really concerned around HIV risks. So if you look back, 10, 20 years, for example, sex education in the schools was really emphasizing the importance of addressing HIV and so on, and that's just gradually dissipated over time. Well, so I think there's a strong feeling it's not something that's going to happen to me in terms of sexually transmitted infections generally. Right,
and I was also wondering if it's people think, well, if I get it, there's a cure for it, so it's not a death sentence, therefore I can have this pleasure right now.
That's one thing, and another is you were mentioning the other common sexually transmitted infections like chlamydia. And those types of sexually transmitted infections really aren't on people's radar screens, so I think people are generally unaware of how common they are, or the fact that in most cases when those STIs are transmitted, it's asymptomatic transmission. So the person who has the infection doesn't know because they haven't been tested and there's no physical signs.
Do people have to worry about it then if there are no symptoms?
Absolutely. So the majority of cases of STI transmission are asymptomatic, and that doesn't mean that it's not going to cause you health problems.
Fertility issues.
Fertility issues. And for example, with syphilis, which we've seen a recent spike in syphilis, that infection remains latent within the system for up to a number of years. So people are not aware they're infected. often until the health consequences start to appear. And that's true for many sexually transmitted infections.
Let's talk about syphilis that has a very particular set of consequences that can affect you later in life. Go through those.
Well, there's a number of serious health consequences for syphilis. So it can lead to heart conditions. It can significantly affect the brain. So syphilis.
Your cognitive abilities?
Cognitive abilities. So there's dementia that can be the result of syphilis. So syphilis is a very serious infection, but many of the other sexually transmitted infections are very serious as well. So there's many common forms of cancer, for example, cervical cancer, increasingly oral cancers that are attributable to sexually transmitted infections.
And are these infections, have they become, resistant to antibiotics, or are they curable?
Many cases of sexually transmitted infections, particularly those that are bacterial infections like syphilis, like chlamydia, like gonorrhea, are curable. However, there's increasingly concern about antibiotic-resistant strains of gonorrhea. So that's something that's on the radar screen for sure for public health officials. Most of the viral STI infections, HIV, human papillomavirus, herpes simplex virus, those infections, you can't just go to the doctor and take a few pills and be cured. There's medications to help manage them, but for example, if you have herpes simplex virus, you're going to have that virus for the rest of your life.
So Alex, who should go to the doctor and get tested?
Good question. I think accessing STI testing should be a routine part of health checkups, so a person can talk about that with their doctor and assess their risk. But the bottom line is, if you're a sexually active person, you need to get regular testing. And there's a myth out there that's persistent amongst a lot of people is that they feel, oh, well, I'm monogamous, I only have one partner, and I don't think I have any sexually transmitted infections. There's no symptoms. I don't think my partner is infected, and so there's no need for condom use. And for many people in Canada, that works for a while, but we tend to go from one monogamous relationship to another. So in the field, we call that serial monogamy. And if you're going from one monogamous relationship to another and you're not using condoms in any of those relationships, and you're not accessing testing when you're entering a new relationship, you're going to be at risk.
So you should be tested before you enter a new relationship?
It's a good idea, for sure. And you can't assume that you're not at risk because you believe that you're not the kind of person who gets sexually transmitted infections, or your partners are not those the type of person who would be at risk. We're all at risk, dependent on what our behavior is. And these are messages that we really need to advocate for in terms of sexual health education in the schools as well.
All right. Very quickly, on that point, what is the correlation? Where is the proof that sex education in school reduces the numbers of infections in the field?
There's certainly a very wide body of evidence that shows that high-quality sexual health education does reduce the prevalence of sexually transmitted infection and does have an impact on people's behavior. The problem is that we have inconsistent sexual health education across Canada. The Public Health Agency of Canada recently funded new Canadian guidelines for sexual health education, and now we need the provinces and territories to follow through on that and make sure that we get consistent, high-quality sexual health education in our schools, and that will help to reduce sexually transmitted infections in Canada.
All right. Alex McKay, Executive Director, Sex Information and Education Council of Canada. Alex, very informative. Thank you.
Thank you very much.